We're going to study about serum tumor markers. The serum tumor markers are very necessary help to confirm the diagnosis. We need a tumor reoccurrence in response to therapy. Like if you are given any therapy to a cancer patient, is it working or not? By serum tumor markers, by the range, by the value of their tumor marker, we can assess to response to therapy. We need the tumor reoccurrence and confirm the diagnosis. And it is not a primary cure, but we can using it at for diagnosis the clinic. But definitely diagnosis made via biopsy. Some can be associated with non-plastic conditions, and these are some tumor markers like alkaline phosphatase. Like alkaline phosphatase is can be better metastasis to the bone or liver. Any cancer is going to metastasis to bone or liver, and also may of Pancreatic disease of bone and seminoma. And secondly, a few ways to LFTs, and LFTs are normal. GGT values like gamma glutamate transferase values are normal. Then you can exclude diabetic origin there. Then you can say this is not a liver disease, can be a bone disease, Pancreatic disease of bone, or seminoma. Second, alpha-fetoprotein. Alpha-fetoprotein are embryonic with the component, but it can be present in associated with hepatocellular carcinoma, endodermal sinus tumors, a yolk cell tumor, mixture cell tumor, ataxia, telangiectasia, neurotube defects. Normally, it is made by fetus. When it is elevated in pregnancies, high level of alpha-fetoproteins can be associated with neurotube defect, abdominal wall defect. But when you get a low value of alpha-fetoprotein, you can be think about Down syndrome. Then we having the SCT, if giving itself mnemonic like hydatiform, Mons, Choriocarcinoma, gastric of plastic diseases. And that SCT is produced by syncytoplasma cells, placenta. If it is an increase in amount, then hydatiform Mons and Choriocarcinoma, gastric disease can be predicted. Like CE 153 for the breast cancer and CE 19/9 for pancreatic adenocarcinoma. Please kindly C's PA is a 15/3 at 19/9. The 15/3 for breast cancer and 19/9 for pancreatic, and C 125 from ovarian cancer, petite ovarian cancer. Calcitonin for thyroid carcinoma. And C is also important component if the carcinoma antigen is a very non-specific. It's for the colorectal and pancreatic cancers. And promograin is mostly neuroendocrine tumors. And promograin like small cell cancers of ADH and increase in ACTH already. Though it having the association, the small cell lung cancer, the small cell lung cancer having association with ADH and ACTH. These cancers having promograin with your high LDH, testicular germ cells in it to use as an indicator of tumor burden. And PSA, it's a prostate-specific antigen. It's the very, very difficult question for which cancer it will be associated. Of course, is it a prostate-specific antigen, then it will be associated with prostate cancer. Okay? And neuron-specific analogs are neuroendocrine tumors, and these all markers are specified and associated with some of cancers. Okay? It's all about the tumor markers, and don't forget that tumor markers are just used to confirm the diagnosis, monitor the tumor reoccurrence, and response to therapy that it given to patient, and thirdly, the final and definitive diagnosis just made by the biopsy for the cancer.